Hi everybody, my name is Jessica. I'm a Canfitpro pre- and postnatal fitness specialist, and today I'd just like to talk to you a little bit about working out your abs during pregnancy. Very first thing you need to do is you need to go to your health provider and you need to talk to them to see if you're able to work out. You have to make sure it's safe for you. Usually you don't want to start a heavy-duty workout program if you're 14 or 16 weeks along pregnant. What also you need to do is you can look up online, it's a pregnancy PAR-Q. You can print that up and take a look at there, and that'll kind of show you a little bit of restrictions. You can even have it signed by your doctor. If you have a personal trainer, you must bring it to them. On there also there's a heart rate chart, and it goes by age, where you have to keep your heart rate safe throughout your pregnancy to make sure that everything's good for you and baby. So, recommendation through Canfitpro is after 14 weeks you shouldn't be lying in the supine position. So the supine position is on your back, so you shouldn't be doing any abs on your back anymore. The best thing to think about is a bowl of soup, so it's supine position. So I'm just going to show you 4 alternatives that you can do past 14 weeks of pregnancy to work out your core or just your abs in the front here, okay? So using a stability ball here, and I'm going to make myself a little pregnant. Okay. If you've never sat on a stability ball first, you would like to hold on to somebody to make sure that your center of gravity is all right. So what you would do is you would just sit here and walk your feet out and make sure your lower back is supported. Supporting your neck, shoulder, girdle, and head. You're going to just give a little slight crunch up and coming down. Little crunch up and coming down. The ball doesn't really move here, and what you want is you want your legs to be at 90 degrees, fully planted on the floor to make sure that you have your stability. If you were, and then you can walk yourself right back up. If you were to try this on your first time, make sure you try it with a partner first to kind of help and spot you to make sure that everything's safe for you. Okay? So next we're just going to kind of go onto the ground here. And what I have here is 3-pound weights. You can use water bottles in your hands, you can use cans of soup, whatever you kind of have available at the house if you like to do this. So, again, becomes a little bit of a issue having a belly to do certain positions, so I'm going to show you 3 more that you can do with having a belly in front here, okay? Holding whatever you have in your hand from your house, feet shoulder width apart, standing nice and tall. You can have a slight lean back, pull one back, come all the way up to the top. Pull one back, come up to the top. I call this the bow and arrow because you're coming back and you're pulling that bow and arrow. When you pull back, you're actually going to involve your obliques. Sitting in a little bit of a V-sit here, you're going to hit your low back here too. So this is a great exercise. You should feel in your abs here. I'm going to just lose one weight. The next exercise, what you can do is you can use a weight or you can use no weight. You can use just your hands. Sitting in the same position, you can do even just a little bit of a twist around your belly here, okay? Again, losing the weight. And again, this will hit your obliques on the side, also your front abs and your lower back, so your core, your full core. And the last one I'm going to show you here is going to hit a little bit more of your lower abs. You can either, obviously if you're too far along, you do not want to kind of lift both feet up, it might be a little bit uncomfortable to come in and out. You can just go single leg, leaning back, pulling in. And you can kind of go around the belly this way a little bit more. Hands are supported on the floor here, so you can support your upper body here, kicking back and coming in. So those are 4 exercises you can do after 14 weeks that you're not laying on your back there. Again, make sure you go talk to your health professional to make sure that everything's safe for you to be able to start a workout program or do any exercises. See you later.